And here to break this down for us is NBC News medical contributor, Dr. Kavita Patel. She's also a primary care physician and a public health policy fellow with the Brookings Institute, Dr. Patel, good morning to you.
Thank you. Good morning to both of you.
Absolutely. Let's dig in here. 100% efficacy. That's an eye-popping number. Can you break this study down for us? How well did the kids tolerate the vaccine, and did they have any side effects?
Yeah, great question. So keep in mind, we're still getting kind of preliminary results from press release. We're all waiting for more detailed data, but it's an incredible study. Over 2,000 children, adolescents aged 12 to 15 that were randomized. A group got placebo and a group got the vaccine. In the group that got the placebo, there were 18 cases of COVID. In the group that got the vaccine, there were 0 cases.
Wow.
That's incredible, leading to that 100% number that we're talking about. But even more important was that it was well tolerated. We don't have the details of what that means, but that does allude to the fact that this was safe and effective. And even more kind of good news, that a month after the second dose, there were incredibly high levels of antibody response, even higher than those aged 16 to 25. It just reinforces that adolescents are great at generating a robust immune response. All very good news, very exciting for all of us who have young kids who are waiting for the next set of data, hopefully around young children.
That is encouraging, because sometimes as parents, you wonder what you're putting into their bodies. You know, you don't have any control. So then do you think the FDA then will quickly approve that request for expanded emergency authorization? And then when do you think that age group will be eligible to get vaccinated?
Yeah, I'm optimistic that the ability to give children 12 to 15 will be available, before the fall school year. And that'll be critical. As a reminder, over the age of 12 is when we realize that children that age can actually transmit the virus almost as easily as adults. So this is critical to getting to that important herd immunity. Here's what the process is to get the FDA to amend the authorization. The company will file, we'll look at the full data. I would predict, though, that we will start to see pretty transparent communication from pediatric groups, advisory committees, and outside kind of advisors in general. So I don't think that'll delay the process, but I do think it's an important critical step to your very point about safety. Yeah. So it should be available before the fall year. That's what the press release alludes to. And the process is an amendment to the authorization, which makes it somewhat easier.
Okay. And what about even younger kids? I know Pfizer reporting this morning that they're beginning trials on babies as young as 6 months in the coming weeks. I've got 2 young kids. I know you do, too. Do you think we could see an approved vaccine for that age group? And would it be faster than you expected?
It's great. Nobody is motivated more than I am to see our children be safe and vaccinated. Trust me, I feel for everybody out there. But here's it might take a little longer. Here's why. They're going to be doing phases where they look at different doses. So that might take the timeline just a little longer. But when I say a little longer, I'm hoping that we're looking at early 2022. But the great news is that if we can have most Americans age 12 and older vaccinated, we really do get to where there's just very low levels of viral activity. And that is going to be something that our younger children will benefit from. I am hoping the fall school year feels a lot more normal, no matter what age range.
My goodness. Before you leave us this morning, can we ask you, this is a hot topic today. The country is now bracing for a possible 4th wave as cases jumped by 13% this past week. At the same time, testing has gone down in some states. Obviously, I guess we should still be vigilant about getting tested, even though more people are vaccinated. What's your thought on that and why the numbers are going up again?
Yeah, very quickly. We know that the numbers are going up, and in particular, certain parts of the country. Unfortunately, Dylan, Chanel, where you are, New York, New Jersey, Pennsylvania, the Midwest, Michigan. So we're seeing kind of what we saw early in the pandemic, where regions were really getting these hot spots. And as a result, we should not be relaxing on testing. It makes sense to do less testing than we did before, but we're decreasing the amount of tests more than we are actually seeing these cases rise. So short line, we should be doing more testing. Also, we're seeing more and more young people who are coming in because older people are vaccinated. So we're really in a race against the pace of vaccinations, which are anywhere from 13% in some states to as high as 26% in some states. Looking at Israel, which can be a bit of a predictor, when they reached about 30% of their country being vaccinated, we saw a precipitous decline. So we really do need to have kind of a 24/7 operation. That will help us avoid a fourth surge.
All right, we have to hold on a little longer. Dr. Patel, thank you so much. Good information this morning.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.